Good morning, Mrs. Jones. My name is Marilyn, and I'm one of the nurses here at Dermatology and Skin Cancer Surgery Centers. What brings you into our office today? Okay, Mrs. Jones, we have received your records from your previous dermatologist, and I see that you've been diagnosed with squamous cell carcinoma on your face and neck. I also see that you've been treated for actinic keratosis quite a few times. Can you tell me how long it's been when the basal cell carcinoma was removed from your cheek and ear by cryotherapy? Will this be the same cheek that the doctor will be examining today? Okay, that's great. Okay, I want to assure you that you are in good hands. Dr. Stroud will be examining you today and will be performing your Mohs surgery. I've been his nurse for over 10 years, and he is absolutely one of the best doctors in his field, so don't worry. He will make sure all those abnormal cells in the epidermis is removed. Dr. Stroud will come in and explain in more detail the procedure when he examines you, but I want to give you an overview of the process so you'll have a general understanding. That way, if you have any questions, you can ask him when he comes in. A little bit of Dr. Stroud's background. He is a board-certified dermatologist who specializes in general dermatology as well as skin cancer detection, prevention, and treatment. He is considered a foremost expert in his field of dermatology and is known for his expertise in performing Mohs surgery. So he does hundreds of these surgeries a year. He will be removing your basal cell carcinoma. That's what's on your left cheek. This is a type of skin cancer that is abnormal, uncontrolled growths that arise from the skin's basal cells in the outermost layers of the skin, which is your epidermis. Dr. Stroud, he'll use a scalpel to remove thin layers of the visible cancerous tissue. When he does that, you'll be sent out to the waiting room where he cuts the tissues into sections, color codes them with dyes, and draws them out of the surgical site. Dr. Stroud will then go back there in our on-site lab. He's also a pathologist as well, and review the tissues under the slides. If any cancer cell remains, he marks the location on the map, and he will then let you know whether you need another layer of tissue removed. If once he finds out that you do, he knows the exact area where he will need to remove the tissue, and you'll be brought back into the operating room where he will renumb the area, and he'll perform that same procedure all over again. And it could last up from anywhere from 3 to 7 hours, depending on how many layers of skin that he will need to remove to determine that he's gotten all the cancer from outside of your cheek. Once the site cell is clear of all cancer cells, he will close the area with stitches. Depending on how deep and how far it has spread, you may have a scar, or it could develop into a keloid. We really won't know until after you come back in for your follow-up, which I will schedule in 10 days to remove your sutures. Once you come in and we remove your sutures, Dr. Stroud will then review your scar and determine if there'll be further treatment needed. We may need to send you to a plastic surgeon, or he could provide some creams or something to lessen the appearance of that scar. Do you have any questions for me? Okay, great. Well, Dr. Stroud will be in a few moments. Again, if I can answer any questions or anything for you, don't hesitate to give me a call, or you can talk to Dr. Stroud about them. Thank you.